public health plays a very significant role in Clatsop County. What I share with everyone, including our Board of County Commissioners, is that public health touches every person every day in multiple ways, from the water you drink, from our sanitation, from the food we eat, the restaurants we go to how we manage our chronic diseases in the community and our harm reduction programs.
Clatsop County is one of 36 counties within the state of Oregon. What makes us a little bit unique is that we're one of a handful of what's called home rule county. Home rule counties are a little bit unique because we have our own charter, and that charter allows us to really organize ourselves based upon the values of the community. So what's a little bit unique for us is that we have 5 elected board members who are the policymakers for the county. And then they hire me, the county manager, to then manage the county and to support them in their public policy efforts. We work as a team. It's very collaborative. It's very professional. And what I would say is the values of the organization are really based upon professionalism, grace, and just kindness. And I think that we do that really well, and I can just say that this is the best board of commissioners that I've ever worked with in my 30 years.
Wow, good to hear.
Public health modernization in Oregon was really started in about 2016 as a concept. It's a very significant piece of legislation. About $40 million has been invested in it in Oregon. There'll be additional funding going forward. And it's a recognition that the public health infrastructure in our state requires updating. And so it's an infusion of money that's not just one time, but going forward to make sure that we have a strong and robust public health infrastructure, adequate staffing, to be able to meet current needs and anticipated needs in the future, aside from what we're experiencing with the pandemic.
I mean, what a challenge it's been for every public health department across the United States. It's unlike any other experience, I think, that any of public health directors been through. We've performed admirably. I mean, it's been an opportunity for collaboration with many of the community organizations, with hospitals. The hospitals in Seaside and Astoria work very well together with public health. You know, the vaccine task force was a creation that, public health started along with the hospitals, and we're, I think, one of the top, counties of getting folks vaccinated. I think we're number 6 in the state out of 36 counties. That's an effort that really was spearheaded by the county public health department, and it's just continued on. I mean, we appreciate all of our updates from our county health director during our meetings. They're always very insightful and informative. But we have full faith and support in what the public health department is doing. They've been just fantastic throughout this.
I think anyone in a position, an executive leadership position, needs to have an inherent sense of curiosity and a willingness to ask questions and be curious and to learn first. Secondly, the ability and courage to think outside the box and to really focus on the opportunities, not just the barriers and the challenges. I think one of the tremendous assets in our community and why I continue to return to public health in this community is because everybody is just a phone call away. The sense of collegiality, support, willingness to come together to address not only the problems in the community, but to think about creative solutions is really quite effortless, especially when I hear challenges that some of my colleagues are facing in other communities. And I think it's played a significant role in why, when we look at the data for the pandemic, our county has fared relatively well when we look at counties across the state. Our public health preparedness program launched after 9/11. While that funding, the base funding for that program has decreased, the infrastructure and the program elements have continued to evolve to meet the emerging sort of potential all hazards issues that could present in communities depending upon where you live. And certainly pandemic planning was part of it, and here we are in this pandemic. Health promotion, chronic disease prevention is one as well. We have many services across the spectrum. We still have the tobacco prevention program. We have a very successful harm reduction program that was launched about 4 or 5 years ago, and it's a well-recognized program that's actually received expanded funding, and it is providing support regionally so that those programs can launch north and south of Clatsop County. Alcohol and drug prevention is a very high priority in our community, and it's a very collaborative effort with many of our community partners. Environmental health has also expanded significantly, and I expect it to continue to expand as we've absorbed our wastewater program. We have a household hazardous waste program, our day-to-day food, pool, and lodging, which are basic environmental health. We have a drinking water program. Again, as I mentioned earlier, we're focusing on climate change as well. And so this program is growing, it's expanding as the community population increases and there's more development. We are recruiting right now for a disease intervention specialist. There's more enhancements and investments going into epidemiology, data analytics, and management of communicable disease in the community. While we see positive impacts in some areas, we're also experiencing the resurgence of some communicable diseases that haven't been so prevalent in the past. Maternal child health is also on the cusp of expanding. There's a new program called Family Connects, which will eventually, it's being piloted right now, but it will expand statewide. It's another home visiting program. But what's really good about this program is that insurance companies, private insurance companies, will have to pay for those home visits. It's not, so it will serve the whole population, not just segments of the population. Our priorities have, to a certain extent, stayed the same, but we've expanded our capacity to be able to address those priorities. And some of that is because of public health modernization and the ability to expand and increase our infrastructure, which then welcomes more expertise and diversity into how public health is practiced and implemented in the community. So it's really the expansion of programs, and then of course how we prioritize. For example, climate change is a much higher priority, is part of the focus this next biennium with our public health modernization funding.
I'm an environmental health specialist, so I'm a health inspector, and I go out and I'm specializing in food, pool, and lodging. So I spend a lot of time in restaurants, and I'm pretty new, so I'm still learning the food code and shadowing a more experienced health inspector. Well, after I finished grad school, I was looking for what to do next, and one of my classmates became an environmental health specialist, and I thought the job was appealing for a number of reasons. And so I pursued it, and I was fortunate enough to be offered this position. And I was really interested because it's a good mix of challenging and rewarding. It's broadly impactful. So working in food, pool, and lodging, I work with people all over the county in these different establishments, and working with operators from all different walks of life.
Well, I used to work in public health when I lived up in Southeast Alaska, as well as in Cambodia, and I really loved doing that. But I've kind of taken a circuitous route from Southeast Alaska and got back into the Pacific Northwest and came here. I love Clatsop County, I love Astoria, I love the people here, and being back in public health has really been rewarding. They have been so welcoming. Working at the PIC, I'm slightly separated from the actual offices of public health, but I felt welcomed immediately, from people online, through emails and exchanges like that. And then once everyone found out that I was going to be doing this new position, I have been inundated with people who are excited to work with me, and I don't know if they know what they're getting into or not, but I'm thrilled to be working with this group.
I am the WIC coordinator. I have been the WIC coordinator for the county for the last 9.5 years. Before that, I actually did work for a year and a half, from 2007 to 2008, as an interpreter and front desk staff assistant. And then I ended up with Healthy Families, and that program closed, and I was gone, and 4 years later, I was back. I love public health. Public health is, for me, is community. It is nurturing people. It feels really good when you work in a place that actually the community members do not mind calling you and asking you for information, advice, guidelines, because they trust you. When the community trusts you, you know you're in a good place. If they will not trust in public health, they will not be calling me, asking me, so Norma, where should we be now? What should we be doing? And they do. They do call me all the time, text me, and it just feels good that public health is giving a service that is nurturing the community, and it is taking care of the community, and it does not matter the background, sex, gender. We are here to serve everybody, and it's nothing better than that.
This is a really great group of people. I'd say everybody has just like a heart of gold.
This person is going to be, the face of public health, and has to be able to go out and communicate within the community. I think the value of the collaborations and cooperation has just really been highlighted over the last couple of years, and so that's something I hope will continue, that we'll be looking to try to find partnerships wherever possible, to look to population health and community health types of initiatives, and it's someone, whoever steps into the position, you have an excellent department to step into. I mean, we have just great professionals. Everybody's, respectful and treats each other with professionalism. I think that they're stepping into a really good situation, and I'm anxious to have that person start, to have a public health director that I can work with and continue to support, because it's such a crucial position in every county.
I think I'm looking for the same qualities that Chair Cuellar mentioned. It's, the pandemic has really shown that counties have to show up when things go bad. And so, knowing that is we need to have professionals who can sometimes filter through the unexpected, sometimes the crazy, and stay focused on what the task is. And these are very difficult jobs. The only way we can get through that is to rely upon each other, and also just be able to filter out what's important and what's not, and to just be supportive. And so what I'm really looking at is just someone who can come in and lead the department, who can do so with passion, who can do so with grace, and then someone who wants to be part of this community. That's what I'm really looking for.
And I work with health fairies. I will say, everybody here has a special skill, and that special something that they do their job so well, and they are so caring. We all have very different skills, but it comes together in a way that our community benefits with those fairies. And if you want to come and work with the health fairies, you're gonna have to be a little bit of a unicorn. And I have for you this special unicorn eraser that it will be yours if you come and work for us. Especially has your name on it. Trust me, you're gonna love being our unicorn. The health fairies are waiting for you.